name is Zachary Town, and as part of the health equity curriculum, we will be discussing vaccine equity today. So this video is part one of 3 videos in a series on vaccinations. And by the end of this video, we should be able to describe the individual and public health burden of vaccine preventable diseases, and then define vaccine equity and describe factors that contribute to vaccine inequity. So in order to discuss disease burden, I'm just going to go through a few examples of preventable diseases. For influenza, we have an annual average of 226,000 people hospitalized, and 75% of these are people 50 and over. And in addition, we have an annual rate of death of 36,000, with 90% being adults compared to children. The annual approximations for invasive pneumococcal disease is 32,000 cases, with 90% of those cases being adults, and then up to 3,300 deaths, with 95% being adults. And all told, acute respiratory infections, including pneumonia and influenza, are the 8th leading cause of death in the US and contribute up to 56,000 deaths annually. And then for shingles, we have an estimated 1 million cases of shingles annually, and that 10 to 50% continue to suffer neuralgia after the case resolves itself. So in order to highlight the severity of vaccine preventable diseases, I thought it was important to discuss the outcomes of vaccination. Within each birth cohort, routine immunization schedules have just strong outcomes. 33,000 lives are saved, 14 million cases of diseases are prevented, direct healthcare cost reductions equate to 9.9 billion, and the indirect reductions equate to 33.4 billion. Despite this, though, 42,000 adults and 300 children in the US die every year from these preventable diseases. So with the stakes of vaccination clearly established, I think it's important now to get into what exactly is vaccine equity. So this is fair and equal access to the vaccine and to healthcare to prevent disparities between different populations. And these disparities can include inequity in the vaccine itself, or access to the vaccine, or include social determinants of health. In the next few slides, I've pulled some data from the Kaiser Family Foundation. And if you look here on this chart, it shows influenza vaccination rates among adults in the 2018 to 2019 season. And we can see that the white adult population has the highest rate at 49%, which is 12% higher than the Hispanic rate. And then we see that the Hispanic adults, Black adults, and American Indian or Alaska Native adults all have lower rates, hovering in the high 30s. So this slide just shows a few factors that can influence access to care. Overall, vaccination coverage among non-Hispanic Blacks, Hispanics, and non-Hispanic Asians are lower compared to non-Hispanic whites. These gaps do narrow when you correct for sociodemographic information, but there are still considerable gaps. Specifically, non-Hispanic Black adults, Hispanic adults, American Indians, and Alaskan Natives are more likely to be uninsured compared to white adults, and this is then an indication of lower vaccination rates. So the uninsured rate for non-Hispanic Blacks are 11.4%, Hispanic adults are at 20%, and American Indians and Alaskan Natives are at 21.7%. So they're the highest population of uninsured. And this is compared to just 7.4% in white adults. So in addition to discussing access to care, I think it was also important to discuss the experience that different races and ethnicities have when accessing their care. So on the left, we have whether or not the patient was believed by the physician during the visit, whether or not, in the middle we have whether or not the physician ordered a test that they thought were necessary. And then on the right, we have um, the refusal rate of pain medication prescription. And so across the board, we see that um, Black people have the highest rate of being just mistrusted by the physician and then their input being ignored. So addressing vaccine inequity in the clinic will be something difficult, but just here are a few broad ideas that could be used. The first one is standardized offering of the vaccination. So this is not a standardized offering a recommendation of the vaccine to each patient. You would want to tailor the message depending on the patient population, but rather a standardized recommendation of the vaccine based upon age or other underlying factors. In addition, everyone should be tracked and kept in their EMR. Use vaccine reminders. Just really reach out to patients and saying, "Hey, it's now recommended you get this vaccination. You should make a visit." And then patient outreach within the community and just really helping to build community trust. With the idea of building some community trust to help address this inequity, I recommend checking out this website from the CDC that has a bunch of partner networks throughout the state. So there's both up to 500 national, state, and local organizations that support vaccine uptake, and you can work with them in your community to help combat vaccine inequity. A particular one is the Racial and Ethnic Approaches to Community Health. They're a larger national network. So again, I recommend going to this website. So when you're talking one-on-one with a patient, I recommend using the motivational interviewing technique. And you can find a video that describes that in further detail on our channel. And then when you're going through and helping the patient define their values and find discrepancies between their values and actions, I've listed some tips that you can use along the way that are more specific to vaccination. So you want to make it clear that you understand their concerns and ask them why they're hesitant. So it's more reflective listening. When misinformation is discussed, it's important to counter that and to provide, a trusted source of information. I think it's also important to note that according to a few different polls, the physician is the most trusted source of information. 85% of people have this perception. And so you can utilize that to help vaccine uptake. As always, endorse the vaccination out of evidence-based reasoning. Tailor your message to the specific people you're talking to. Some people may have different concerns, and so you want to address those concerns so not every message will be standard. And make sure you discuss the side effects. That seems to be a particular issue that patients like to bring up. And then you can always prepare your staff to answer questions as well. So in this case, the information is not just coming from you, but everyone in the clinic has the same perspective and is willing to help the patient. So I just wanted to round out this video by providing the recommended adult immunization schedule from the CDC. And it goes through multiple different types of vaccines with a key at the bottom. And it goes through different conditions that a person may have and whether or not a person would then be recommended for the vaccine if they do or do not have any one particular condition. As always, thank you for listening.